Chapter 13 is vascular access and medication administration. This is one of the main things that we'll be learning at the advanced EMT level, is establishing how to establish vascular access, the different methods that we can establish vascular access, and the different places where we can do it. So some self-administered medication, peer-administered medication, assisted medications to a patient. So some names, the effects, indications, the route of administration, and dosages for the medications administered. The actions, contraindications, complications, side effects, interactions. We will learn a lot about those in the last chapter. And then, so it's important that you understand the formulary of medications that you have in your field pocket. Like I said in the last chapter, this will vary from agency to agency, just depending on the needs of the area that you are operating in. So as a pre-hospital care provider, but in general, the each medication's mechanism of action, the indications for it, the contraindications for it, the route of administrations can be a little different in each area, but for the most part, will be the same. The dosages for each medication may differ from area to area, so you need to be able to differentiate from the protocols that you're working in. Some adverse reactions, what to look out for, and then what to do in the event of an adverse reaction. Okay. First rule of medicine is to do no harm, so it's to ensure that a specific medication is clearly indicated to treat the patient's condition. You need to carefully make an assessment of the patient to help ensure that you're only doing this for the beneficial needs of that patient. Okay. Don't just be giving meds to be giving medications. Okay. That's not one of the things that is needed in this situation. Okay. So just you need to have a reasoning as to why you're actually giving that medication. IV therapy is one of the most invasive procedures at the advanced EMT level. So a few procedures will require more training and practice. For efficiency in IV therapy and techniques required for most advanced life support procedures. Medical problems alter the established balance among the systems of the body. So fully assess a patient's condition and identify and treat life-threatening injuries and illnesses that alter homeostasis. Some basic math will be needed. If you need a review of math, please let us know. And to calculate the appropriate medication dosages. Here recently, we've had a lot of supply chain issues. So we were getting medications from different manufacturers, and they were coming packaged differently in multiple dose concentrations. So we were having to be very mindful of this as far as making sure that we gave the right dosage of that medication based on the concentration in which we've received it from a particular manufacturer. Okay. So, when I first got started, we kind of had the same medications. They all look the same. We got it from the same supplier. But over time, we were, due to the production error that we were having or problems that we were having, we were having to make sure that we were being careful, making sure that we were looking at the bottles, looking at the concentration that we had to make sure that we were giving the right dosage of that medication. So drug doses and flow rate calculations are common areas of confusion. So make sure you administer, if you do by chance give an adverse or incorrect dosage, you could cause death. Okay. So, don't try to hide it. The best way is to admit to it, and possibly know a way of getting a way of treating the adverse reaction if needed. All right, it is governed by local protocols and online medical direction. Your state office will give a guide to medications that could be carried throughout the state, and then your local agency, a medical director may want to change that a little bit, just depending upon the demographic of patients that you are servicing in your particular area. Okay, so most EMS services carry drug boxes. Standard orders may allow certain medication administration, and so follow your local policies and procedures. So make sure that you know the procedure for administering any medication, obtain an order for medical control if that's needed. Make sure you know the indications, contraindications, therapeutic effects, side effects, and appropriate dosages. Went over this in the last chapter too. These are the 9 rights to medication administration. Please make sure you follow those and that you can document everything as it's needed. So, all right, you need to consider the patient's age, patient's weight, if you have a weight-based drug, the clinical status, allergy history, possibly had an allergic reaction to a particular medication in the past, or one, kind of like it. Your chronic medical problems that the patient may have as a whole, and other drugs the patient may be taking. Make sure you understand the physician's orders. If you got orders from an online medical direction, or your standard protocols, repeat the orders word for word for verification. Make sure that you are allowed to give that medication in the particular way that he's expressing you to. Make sure it's within your formulary. Anyway, the advanced EMT should probably not be given fentanyl or controlled substances. Is what I'm trying to say there. Inquire about any medication allergies that the patient may have. Verify that you have the right medication in your hand. When we were having different suppliers, the medications were coming in different colors. I can remember, morphine being a clear vial with, black writing on it. Okay, and then we started getting it with blue writing, and there's, making sure that you have the right medication in your hand that you're fixing to draw up and administer to somebody. So check the expiration date. Also, that should be done monthly or if not weekly. But sometimes we reach for one that's been hiding, and we pull it out, and it may be out of date. So verify the form, the dose, and the route of the medication itself. Make sure you check out the cloudiness, in the valve. It could be, happen after it's been sitting there for a while or it's been injected into the IV tubing. So if that happens, you may want to actually clamp off the tube prior to it actually hitting the veins itself or the vessels. All right, dispose of your syringes and needles safely. Monitor the patient for possible adverse side effects, and document your actions and the patient's response on the patient care report. Okay, so you need to be taking vital signs after you administer a medication. Okay, that's just one of those rules. I don't care if you got a 1-minute transport. If you gave that medication 1 minute prior to arriving at the hospital, you probably need to do a set of vital signs right fast to make sure that there ain't any trending that you need to document there. So here's a specific list of stuff that advanced EMTs can administer. Please remember, this is like a national standard. This is not, built just particularly for North Carolina or a particular state. So you may see some drugs on here that you're like, no, we never seen those. But this, this is built on a national standard list. All right, cells are enclosed by a cell membrane, the phospholipid bilayer. The compounds are allowed to move through the cell membrane to enter a cell. There is selective permeability there, and it's composed of a phospholipid bilayer. which is an important barrier to fluid movement and the acid-base balance. So atoms carry charges, both positive and negative. Two or more atoms bonded together form a molecule. Inorganic molecules give rise to electrolytes, and water in the body helps stabilize the electrolyte charges. So these cations have an overall positive charge. The anions have an overall negative charge. So, and then we have sodium. Sodium is basically salt. It's the principal extracellular cation that is needed to regulate the distribution of water throughout the body. So its major function is an adequate cellular perfusion, and it's a major buffer that's being circulated around. Sodium potassium pump is helped in the presence by the presence of insulin and epi. So hypokalemia is low potassium. It's decreased skeletal muscle function, GI disturbances, and alterations in cardiac function is some of the side effects. Side effects of high potassium hyperkalemia is neural cell transmission, and which can result in cardiac arrest. Calcium is a principal cation needed for bone growth, heart muscle growth, nerves and cell membranes, and blood clot. Hypokalemia can result in skeletal muscle cramps, abdominal cramps, spasms, hypertension, and vasoconstriction. All right, so bicarbonate levels are related to conditions of acidosis and alkalosis in the body. Chloride primarily regulates the pH of the stomach. It also regulates extracellular fluid levels. And then phosphorus is an important component of the formation of adenosine triphosphate, which is your energy. All right, body fluid composition. Fluids found in the body are composed of dissolved elements and water. So our solution is a mixture of two things: a solvent, this fluid that does the dissolving, and solute is dissolved particles contained in the solvent. So balance across the cell membrane has two components: balance of compounds and balance of charges. So materials flow from an area of high concentration to an area of low concentration, establishing a concentration gradient. So this depends on whether the cell membrane will allow the material to pass through it. So diffusion is compounds or charges concentrated on one side of a cell membrane will move across it to an area of lower concentration. All right, filtration is the type of diffusion used by the kidneys to clean the blood. Water carries dissolved pollen compounds across the cell membranes of the tubules of the kidney where the dissolved compounds are trapped. Active transport is a method used to move compounds to create and maintain an imbalance of charges. So we have the sodium potassium pump. Okay. Ninja Nerd on YouTube does a great job of describing this sodium potassium pump. So, if you get a chance, look on YouTube, look up Ninja Nerd. He's pretty good at being able to draw the pictures and be able to describe this sodium potassium pump. All right, osmosis is the movement of water across the cell membrane. It occurs when there's a different concentrations on each side of the membrane. Okay, so if a solution is isotonic in the middle, it stays normal size. As it becomes hypotonic, it swells the cell itself, and then eventually the cell bursts. As it becomes hypertonic or high solute concentration, it actually causes the cell to collapse and it's non-functional. So hypertonic has a greater concentration of sodium, and then hypotonic has a lower concentration of sodium. Okay, so the higher concentration, the more positive the more that the net water is moved out, the hypertonic solution, the less salt, the greater the cell can become filled with water and fluid and burst. Okay, so intracellular means inside the cell, extracellular means outside the cell. So water levels in these compartments constantly shift. Homeostasis controls the mechanisms ensures balances is restored. The vascular system function has a fluid highway. It contains cells, and this can be thought of as another fluid compartment. Okay, so extracellular compartment outside of these cells has intravascular areas, and that's the water portion of the circulating system surrounding the blood cells. Interstitial is water outside the vascular system and between the surrounding cells. Okay. So there's three fluid compartments in the human body. You have intravascular, which is extracellular, interstitial, which is extracellular, and then intracellular itself. Not extracellular fluid occupies any area that is not inside the cells. So it acts as a conduit for transferring gases and nutrients between the vascular and intracellular fluid compartments. These levels are regulated by the presence of sodium. All right, perfusion occurs in capillaries. This is the intracellular fluid that is within all the cells of the body. Large proteins within the cell can draw fluid into the cell, and the sodium ions drawn into the cells are removed via the sodium potassium pump to prevent cellular lysis, which is rupture of it. So, water, some form of water surrounds all cells. The body adjusts the changes in the balance of intracellular fluid and extracellular fluid by retaining and eliminating water. The maintenance of the internal environment of the cell is regulated by feedback systems. All right, so dehydration is depletion of the body's total systemic fluid volume. It's common in older adults. And it could be causes of like diarrhea, vomiting, hemorrhaging, insufficient fluid intake, and infection. All right, overhydration is a result of total systemic fluid volume increases in the body. So fluid fills the vascular compartments, filters into the interstitial compartment, and is forced from the engorged interstitial compartment into the intracellular compartment. So this fluid backup can result in death also. A lot of times we have shortness of breath, puffy eyelids, edema, polyuria, excessive urination, crackles, and acute weight gain. All right. All right. IV fluid composition. Compounds and ions dissolved in a solution are identical to the ones found in the body. Each solution is a concentration of solute and a solvent. Since sodium is used as a benchmark to calculate a solution's tonicity or tonicity, concentration of sodium in the cells of the body is approximately 0.9%. So common IV fluid is normal saline. Altering the concentration of the sodium in the IV solution can move the water into or out of the body or out of the fluid compartment in the body. So, many types of IV solutions, but the main two are crystalloids and colloids, right? These are categorizing the isotonic, hypertonic, and hypertonic based on their tonicity. Crystalloid solutions dissolve crystals in water, contain compounds that quickly dissociate in a solution, and is the best choice pre-hospital care in patients with a body fluid loss. Okay. They do not have the capability to carry oxygen, and boluses of 250 milliliters should be given to maintain perfusion but not to restore the blood pressure. Okay, so increasing blood pressure with IV fluids dilutes the remaining blood volume and may increase internal bleeding by interfering with homeostasis. So basically, IV fluids don't have the capability of carrying hemoglobin. This is why we have to be very careful how much fluid we're actually administering to these patients, because what blood is left, we need it to carry the oxygen around so that exchange can happen. And we'll talk about that later with maintaining blood pressures around 90 in your shock patients. All right, colloidal molecules usually too large to pass out of the capillary membranes that remain in the vascular compartment. So they do have a very high osmolarity. So they draw fluid from the interstitial and intracellular compartments into the vascular compartments. This works well in reducing edema while expanding the vascular compartments. So it could cause some dramatic fluid shifts, which could be a bad thing. Okay. There's three different categories here: isotonic 0.9 sodium chloride, which is noted normal saline and LR, hypertonic D5W, and hypertonic 3% saline blood polymers, and albumin. All right, isotonic solutions have the same osmolarity as serum and other body fluid. They expand the contents of the intravascular compartment without shifting fluid to or from other compartments. So the fluid remains in the vascular compartment. So be careful with fluid overload. Our LR solution is generally used for field patients who have lost large amounts of blood. D5W is a special type of isotonic fluid solution. So as long as it remains in the bag, it's considered an isotonic solution. After administration, the dextrose is quickly metabolized and the solution becomes hypotonic. Hypotonic solutions lowers concentration of sodium within the cell, so they hydrate the cells while depleting the vascular compartment, and may be needed for a patient who is on dialysis when diuretic therapy dehydrates the cells. All right, it is dangerous to use because they can cause a sudden fluid shift from the intravascular space to the cells. So be careful with these solutions on patients who are experiencing head trauma or stroke, or patients with burns, trauma, malnutrition, or liver disease. All right, hypertonic solutions, osmolarity is higher than the serum in our blood. So have more ionic concentration than serum, shifts body fluids into the vascular space and pulls fluids from the electrolytes from the intracellular interstitial compartments into the intravascular compartment. It can be used to help stabilize the blood pressure, but it's rarely used in the pre-hospital setting. Okay, try not to fluid overload if you have a hypertonic solution. Okay. And if you do get your hands on this, do not use it on DKA patients or others that may be at risk of cellular dehydration, because basically you're decreasing the volume of the cells. All right, here's your IV equipment. It should be sterile. Most of it is now. All the different parts of it. So basically, this is your IV fluid. This is a 10 ml syringe of saline. This is your needle packaging with the needle here capped off, and it's retractable. Many people, I call this the extension set, and this is the administration set. Some people call this a lock. There's many different names for it, but just be familiar with what it is in your area. All right, the prep kit here, which has got the iodine or the antiseptic wipe or solution, that whatever may be in it, alcohol wipes, TheraTube, and then the Tegaderm and the tape. And these are your tourniquets or constriction bands, is what the book calls them. So needing to identify not only what you carry, but the situation of your patient and the needs of your patient. Okay, if you're needing to give a big bolus to a patient to get a sustained blood pressure, you might need that 1,000 ml bag. Okay, if your patient's dehydrated for some reason or in acute shock, yeah, I could go with the 1,000 ml bag. These 500, 250 ml bags um, help you restrict fluid a little bit more than this 1,000 ml bag. Okay, you do a large bore 1,000 ml bag, IV access. This bag is going to be going in minutes. Okay, and you probably may not have meant to, but that's why it happened. These should be in a plastic self-sealing bag before you administer them. If not, probably need to discard this bag if you don't know and it wasn't time stamped how long it's been out of its self-containing bag. So the bottom of each bag has an access port for connecting, which is down there in that yellow piece, and the remover pigtail that represents a point of no return line protects the sterile access point. That you really can't see, you can kind of see that on that 250 picture there. All right, most fluids in IV bag into the patient's vascular system has a piercing spike protected by a plastic cover. So different sizes for different situations and patients. Usually there's a visible number on the package and it indicates the drops it takes for 1 milliliter of fluid to pass through the orifice into the drip chamber. Oh. So we have a 60 watt set here, which is a micro drip. Usually it is small and it's ideal for your pediatric patients so that you don't fluid overload them. Your macro drip is 10 to 15 glots per minute. That's what we usually use for most adult patients. And then your blood sets. These blood sets are a special type of macro drips. So you can put multiple IV bags in there. What it was really used for is one of these piercing sets was used for the whole blood or the blood that was going to be given. And then the other one is used for a saline bag because they have to mix each other to be administered to the patient. You don't see a whole lot of blood tubing out in the field unless you work in an area that has a high trauma incidence. All right, next we need to choose an IV site. A lot of people will advise to work distal, and then we can go proximal upwards into the anterior or into the medial area of the body. There's many different veins here. So you just need to be able to find you one, make sure that it is a vein, make sure it's springy when palpated. Okay, this guy right here has got a lot of good veins going on here. So try to avoid the extremity that possibly has trauma in it. Opposite side of a stroke victim, or do not stick a fistula extremity or distal to a dialysis fistula. So most patients you want to start at the anterior, the antecubital fossa, or go higher. However, if you do see some good hand veins, it probably wouldn't be a bad idea to work there. All right, there's over the nadir angio calves and butterfly calves are the most common. We'll use the over the nadir calves, which is the picture on the bottom. All right, there's different sizes. They go from 24 to most people carry up to 18 gauge now. Some agencies carry 16 and 14 gauges. Those are going to be used for your, trauma patients that need fluid boluses pretty quickly. But an 18 gauge will also do the same thing. So keep the bevel up and maintain adequate traction on the vein during cannulation. All right. So you probably want to apply the constriction band prior to putting the needle in. But once you've chosen it, advance the catheter through the skin until the vein is pierced. Many things that you can use for a constriction band also. There's commercial devices out there. Some people use blood pressure cuffs, gloves, surgical tubing, anything that can cause constriction proximal to the IV site that you have chosen. Okay, you want to prep the site um, and then apply a gentle downward and lateral traction on the vein with your free hand and then insert it at a 45-degree angle according to the book. Okay. Once you've pierced it, angle it down to a 15 degree angle and advance the catheter. Okay. All right, after you've got the catheter fully advanced, apply pressure to the vein just proximal to the end that ends well the catheter. Remove the needle and dispose of it in the sharps container. So the sharp should be self-contained inside the needle, and you should be able to get your blood into the chamber. All right, if blood draw is permitted, you can do that now. So just follow your local protocol on tube, on blood tubes that you're going to use in the blood draw. So tape the area down, secure the catheter. There's many different ways that you can do this. Also put your tegaderm down and just make sure that it is secure, it won't come out of place. So as you're going through your clinical time, you need to learn your way of doing this so that you know that it won't come out. All right, you're gonna learn how to change the IV fluid bag just in case it's been depleted while you're traveling and transporting down the road. So basically, you're gonna prepare the new bag, remove the old bag, and then spike it. Spike the new bag into the ports. Just make sure the drip chamber is filled appropriately before opening up the roller clamp. All right, to DC the IV line, you're going to cut everything off, stabilize the catheter, loosen up all the remaining tape, and then you're just gently pull it out. Tell the patient it's going to feel kind of odd, but you just can gently remove it. Saline locks are good for your patients that may not so much need fluid resuscitation. Maybe you just need IV access for some reason, in case something happens in the future, or that you want to restrict fluid administration to this patient. Saline locks are a good way to make sure you don't give that fluid accidentally. All right, there's access ports at the end, which is this blue part, which is through the needleless system. But you can also attach a 10 Glock or 60 Glock set to this port also. All right, IJs or EJs are also another access point right there at the neck. So usually they're very large. If you have somebody that doesn't have any peripheral access and you need to, get access quickly, I probably wouldn't recommend this on an alert-oriented patient. So basically, you're just going to tilt the patient's head to one side or the other, and those EJs should pop out. All right. If you do have a flow problem, check the IV fluid, make sure that it's good and there's some in there. Check the administration set, making sure that you don't have any thumb wheels or cutoffs, constricting the drop set. The height of your IV bag, make sure it's high enough so that gravity can do its job. And the type of catheter used, making sure that hasn't been sheared or loosened or bent inside the vessel. And then making sure that the constricted band is off. All right. Sometimes you have a local site reaction that's probably due to infiltration is the main thing. This is basically where fluid escapes into the surrounding tissue. The IV line passed completely through the vein, so you pretty much, you're making a hole outside of the vessel itself, so it's getting into the tissue space around the vessel. The cannula will start as a two-chamber angle and is entered into the fascia surrounding the vein and not into the vein itself. Okay. So a lot of times you start notice a lot of edema in the area, and it's possibly what happened. It's just infiltrated. So, occlude the vein. Check for tightness and pain around the vein site. So to correct the discontinued administration and reestablishment of the IV line and the opposite extremity or a site that's more proximal to that area. All right, thrombophlebitis is inflammation of the vein. This could in symptoms could be fever, tenderness, red streaking associated with the vein. So localized irritation, infection, prolonged IV therapy, irritating IV solutions, too rapid of an infusion. A lot of times we don't really see a thrombophlebitis. An occlusion, patient could be bending their arm back and forth and it's actually occluding the vein off. So it could be positional. A lot of times we have the catheter right up beside the wall of the vein. Or the vein is in a joint somewhere and it's being moved and it's clotting itself off at times. All right, to determine whether the IV line should be reestablished, using a syringe, fill with saline, add pressure to the line, and gently apply pressure to the plunger and disrupt the occlusion and reestablish the vein. So if the occlusion does not discharge, discontinue, and then reestablish. All right, hematomas can occur as possibly due to accumulation of blood in tissues surrounding the IV site. So you put the IV site, the catheter in, possibly could have went through the wall of the vein. You get this big occlusion and edema in the area, and it's surrounded with blood. Also, it's usually very possible with patients that are on some kind of anticoagulant therapy. So you have to be very careful with this. You could have possibly hit a nerve, tendon, or ligament damage. So usually results from improper identification of anatomical structures around the IV site. So sudden severe shooting pain and numbness in the extremity. You could possibly do arterial puncture too. So stop the IV administration, apply direct pressure to the site until bleeding is controlled. Okay, and it's going to take a lot of direct pressure to stop that bleeding because you actually hit an arterial vessel. All right, systemic complications can develop from reactions to complications with IV insertion. So, it's very possible you can have an allergic reaction. So, and it's usually, due to sensitivity to the medication or to some type of the material that's being used. If you do have itching, shortness of breath, edema in face and hands, urticaria, bronchospasms, anaphylaxis, and wheezing, discontinue and remove the solution. All right, catheter shear can happen. Catheter just shears, creating a free flow inside the vessel itself. So you just possibly have to remove it and pick another site. Circulatory overload. Be careful with this. This is why you need to possibly use the saline lock so that this doesn't happen. So cut the IV access off, and then treat your patient appropriately to fluid overload. Some people have a vasovagal response, so and because of the sight of needles and blood, so anxiety, diaphoresis, nausea, super episodes. So, all right, there's your different sizes and the color code to each one of them. This is pretty standard across the board for all manufacturers. So just be familiar with that. Kind of relate yourself 24 to yellow, 22 to blue. Just in case you're looking at a color and you really can't find the size of it right offhand. if you can correlate the size with the color. Smaller the size, the less fluid that can flow through it. The larger the diameter of the catheter, so the quicker the fluid can go through it. All right. Pediatric considerations: hand veins are painful, but remain the best location for choice. So making sure you protect the IV. Most places carry little IV short arm boards, and this is just so you can tape it around the IV site, so that hopefully the kid doesn't pull on it, or something like that. Geriatric IV therapy usually are smaller needles. These patients probably have skin conditions, and you can cause skin damage just due to the sensitivity of the skin. So, um, avoid small spidery veins, weave back and forth. Don't use varicose veins at all. All right, IO infusion is just going to be something that is regulated by your local system, but you will learn about it at the advanced AEMT level. So basically, it is administering fluid or medications through the bone. All right, so the long bone consists of the shaft, the diaphysis, the ends, the epiphysis, and the growth plate, the epiphyseal seal. Iris spaces compromised spongicalis, bone of the epiphysis, and the medulla cavity of the diaphysis. So the sternum, we don't usually use, but it can be for certain devices. The humerus is usually what we're going to use. The distal tibia is what we're going to use. So the sternal notch using IO devices, adhesive target. You locate the proximal IO site, palpate the tibial to velocity, and then palpate 2 centimeters medially. So, and then the distal tibial site is identified as the medial malleus and palpate 2 to 3 centimeters above. Yeah. These are some old manual IO devices. We don't see a whole lot of those. So, fast device is what you see here. Basically, you hold it, then you hold it up against the skin, and it punctures inside of the skin and the bone itself. EZIO is pretty much what everybody has. So it's a handheld battery power driven with an attached needle. So only thing about EZIO is please remember that each time you press that button, the battery mechanism of that device gets lower and lower. And there's no way to recharge those. The big was a spring-loaded device. Same as like the fast. What? The spring-loaded device here. So, all right. Some complications with IO. It's when it comes out of the bone and it does not rest in the IO space. This infusion does not run freely, and the site rapidly becomes edema. Okay, so you'll see a whole lot of fluid accumulation around the site, and especially in the posterior area. So be mindful of that. Osteomyelitis is inflammation of the bone and muscle caused by an infection. So you go through it, and then suspect a pulmonary embolism if the patient experiences shortness of breath, pleuritic chest pain, and cyanosis. Some contraindications: osteoporosis, osteogenesis, bilateral replacement, and prosthetic limb. All right, so mathematical principles used in pharmacology. Please make sure that you understand math. Percentages are a part of 100, denotated by the percent symbol. Decimals distinguish numbers greater than 0 from numbers smaller than 0. So the decimal system is used in multiples of 10. So you got the meter, which is the basic unit of length. The liter is the basic unit of volume, and gram is the basic unit of weight. So micro, milli, centi, and kilo. So 1 liter equals 1,000 milliliters. To convert grams to milligrams, multiplies times 1,000, or move the decimal point 3 places to the left. To convert milligrams to grams, divide by 1,000, or move the decimal point 3 places to the right. So to convert pounds to kilograms, like you have to do with patients, because most pediatric patients, most of their medications are weight based. So divide the patient's weight by 2.2, or you can take the weight in pounds divided by 2, then subtract 10%. All right, dimensional analysis is the easiest way to calculate drip rates. So which administration set to use the length of time for the infusion and the amount of flow. All right, so you're going to have to know the medication concentration. So you're going to have to be able to take the total weight of the medication contained in a specific volume. They are contained in different kind of volumes and different mixtures, concentration. So you need to be familiar with that. So to be the volume to be administered, the desired dose in milligrams divided by the concentration on hand, milligrams per liter. Okay, so this is something that we'll have to practice over time and in class. Pediatric dosage use loop-based resuscitation tapes or field guides with tables and charts for reference. Steps for administering by specific routes. Oral route, you may use a small medicine cup, medicine drop, a teaspoon, oral syringe, or a nipple. So basically, you can place it in your gloved hand, ask the patient to take a hold of it, and then making sure that they don't have any kind of allergies to that medication. And they'll either take it by mouth. Following standard orders, contact medical control for permission, check the medication, determine the appropriate dose, and then go through your rights of medication administration. Specific routes. If rectal administration D50 is allowed, it should only be used as a last resort. Okay. And this goes through the steps of administering drugs rectally. To give it through the GI tract, you may administer those weights there. So you can draw it up, usually just kind of push it through the plunger. Ampules on the top, vials on the bottom, prefilled syringes. These are valves. So 2 separate valves and an active valve. Here's your prefilled syringes. Please make sure that you know whether you got the needle system or the needleless system here. Subcutaneous administration at a 45-degree angle with a syringe and a needle. There's different sites here that you can give subcutaneous medications. IM administrations at a 90-degree angle with the needle. And there's your areas that you can give IM administrations. All right, so medications are taken upon the tongue and then intranasal. But please make sure if the patient is still breathing, you administer this while they're inhaling. Okay. You have the atomizer there at the tip of the syringe, so you'll be shown that. Middle dose inhalers here, and then your MDI can be delivered by mouthpiece or mask there. Nebulized method here for your bronchodilators. And then CPAP administration. And then IV, of course. Okay. Once you administer the medication, you should shut off the clot set above the site so that you make sure that the medication is going down into the IV catheter. Give it, and then you should give a bolus behind it, whichever route you need to do that with. So cleanse the port you're going to use with alcohol, insert it, and then, make sure you pull back on the plunger. Make sure you don't, have a large amount of blood, or make sure that you do have blood return so that you know that you're in the vessel, and then flush it on, push it through. Make sure you document the times. Make sure you document any kind of reactions you have to it, any adverse reactions, any adverse change of vital signs. Sometimes we have patients that don't tell us exactly what's going on, don't tell us that they're allergic to a certain medication, don't tell us that, the synergism effect that we can have with medications that we're given, and the medications that they've taken. But if this happens, just document it, okay? And then try to go through steps to reverse the adverse reaction. Most important thing about medication administration is, document what happened, even if it was wrong. Make sure you just document what you did.